Hello, I'm Robert, fact checker and science blog and helping scared people. And this time I want to talk about this thing that's being said so much, that the idea that experts have a consensus that COVID-19 is now airborne. This is not true at all. The WHO do not say it is airborne. And especially if you go and look at their videos they do. I mean, in fact, if I have a look at that, I'll show you a picture of them. There, you see there, you can see them here at the beginning of this. Does he actually talk about why they don't do masks in that one? Yes, here we are, about why they don't do masks. Let's just play this. Take a moment for it.
Down to a loved one. Thank you, Maria. Question came in as well. Again, why are we not wearing the mask? So maybe we can also clarify when people should wear a mask to protect, as part of all the other actions you just mentioned.
So yes, so masks are one of the tools that can be used in the prevention of transmission between people.
So anyway, I'll get another picture so you can see it. There you are. You can see how it's set up. See, they're like that. And there's no masks there, and they've got at least a metre between each one. Now, the WHO know what they're doing. So if you look at the UK, then nearly everyone in the COVID-19 response team actually got COVID-19. So that's hardly a very good advert for their advice to the rest of the country. And if you look at the WHO, then as Mike Ryan explained, he has been taking public transport in Geneva all the way through the outbreak. Maria van Kerkhove, then she was one of the team spent 9 days in China, and at the height of its outbreak. And she went around all the hotspots, not keeping away from COVID-19, but going right up to the worst places. They didn't go into the actual COVID-19 wards, but they were out interviewing people at a distance, at the right distance of a metre, or maybe a bit more. And so these people know how they run safe. The WHO run safe. And they have not got COVID-19. Dr. Tedros hasn't got it, Maria van Kerkhove, Mike Ryan, and none of them have got COVID-19. And it's not because they've kept away from it, it's because they've been taking the right precautions. And Mike Ryan, he explains in this video that every day, so they're working a 7-day week at the moment. They have been since the beginning of the outbreak. And every day, then Mike Ryan, he comes in on public transport because it's better for the environment. And he reasons that for his priorities, his own personal priorities, he says we have to work out our own personal priorities. And he explains that every day, if you cycle into work, say, then you are doing something incredibly risky. If you were to do just one little wobble in the wrong direction and you're dead. And yet we know how to handle these things, and we are perfectly set up to be able to manage situations of really extreme risk, cycling into a city when the car's going past at all times. Then potentially, the worst case outcome is death. And yet we are able to handle that. We are very good at recognizing and negotiating with risks. So he says that you've got to do the same with COVID-19. And then he says that he does this public transport every day, and he knows how to manage risks. He knows how not to die of COVID-19, just like you know how not to die of your bicycle cycling into work. But you've got to understand how it works. You've got to understand the science. And so, for instance, when he gets on board the bus, then first of all, if it is a crowded bus, then he just won't get on. He's managing his risks. And if he can't do the physical distancing inside the bus of at least a metre, they say a metre, it's not 2 metres, 1 metre, then he won't get on the bus. So that's managing his risk. And if he's going to be 10 minutes late, then he normally would still, that's his decision that he's made. And then he says that he uses his elbow to try and press the button, because the only thing that you need to worry about is your hands. And then your hands touching your eyes, nose and mouth, or your hands touching other things. So when he gets on the bus, before he handles his iPhone or his mobile phone or whatever he has, then first of all, he always takes hand sanitizer with him. So because he can't always use the elbow, they don't react. And there'll be other things he might have had to touch to get to his seat. And as soon as he sits down in the bus, he uses the hand sanitizer and he thoroughly washes his hands, totally thoroughly. And then once he's done that, it's safe to use his iPhone and everything else, put on his headphones and everything, because he now knows his hands haven't got COVID-19 on them. And then keeping the distance from other people, and then he's not going to get affected by the droplets. He's more than a metre away. So these people know what they're doing. And you know, he knows what he means by risk. Mike Ryan has been, he's involved in, he's been right at the front line, tracking, tracing contacts of Ebola patients. So he goes and finds Ebola patients and he goes and looks for their contacts and traces them. He has been doing that. He manages the team, but he isn't one of these people who stand away from the thing that he's managing. He's there in the front lines doing it with everyone else. But not only that, in the Congo, where I think there are 20, he said there are 20 different military groups in a shooting war. So he has had to do the contact tracing in the middle of a shooting war with people firing bullets and some of the health workers dying. And he did that work with a bulletproof vest and bulletproof jacket and helmet, because he was at risk of being shot. So they're very modest. He never tells. The only reason that we know that is because Dr. Tedros brought it up, because of the people were saying, all the people of Trump saying, oh, the WHO people, they're conspiring to kill people, whatever, and I mean, other people saying that, or, saying, the WHO are not saving lives. So this thing being saying, that being shared of Trump and other people saying the WHO aren't doing their job of saving lives. And in that context, and that Dr. Tedros brought up what Mike Ryan would never have said himself, that Mike Ryan has actually been involved in the front line, doing contact tracing with bullets firing, going around. Oh, and it was in the context of contact tracing, and people saying, oh, we can't do contact tracing in the United States. Of course you can. If you can do contact tracing for Ebola with bullets flying past, and he goes door to door, he doesn't do it over the phone. You can't do it over the phone in Congo. And he goes around door to door and finds the Ebola patients, talks to them, and then finds all their contacts, and then goes and finds all the contacts, and all of these people, of course, could have Ebola. But he knows how to keep himself safe when interviewing people with Ebola. So that's the sort of people the WHO are, and they run safe. So these people know what they're talking about when they give this advice. And a lot of the people who tell you that it's airborne and all that, they never have to do this stuff. They don't have to do the contact tracing in the middle of the Congo with people shooting bullets around. So I listen to the WHO, they know what they're talking about. A lot of these other people, they're just speaking through their hat. There are engineers, for instance, who know an awful lot about engineering, or they are specialised in some particular area of medicine or something, but they don't have the whole picture. And so what the WHO say, and they've got very, very strong evidence here, outside of the medical facilities, and they're saying that some outbreak reports relate to indoor crowded spaces. And so we gave the examples of quiet practice, restaurants, fitness classes. And then in those situations, then the short-range aerosol transmission can't be completely ruled out, Now, but it can't be proven either, because the problem is that the droplet, that these are all situations where people are close enough within the meter range, not 2 meters, within 1 meter in those situations where it's so crowded, that you can exchange by droplets. And in super spreading event, you can get transmission from one person to many people via droplets. You can also get it if hand hygiene was not performed. So, for instance, with the choir, in that example of the choir, the hand sanitizers were offered at the entrance, but they didn't have evidence that everyone took it up. And then there was a bit in the middle of it when they had some shared tangerines that people could go and pick up. And then you don't have a very clear idea about how close they were when they were talking during the singing. So it's very difficult to look at that and say, oh, well, it must have been aerosol transmission. Because it's so messy. This was not a controlled experiment. They didn't expect to get COVID-19. And they were taking precautions in a haphazard way. So they just don't have, and you can't do the controlled experiment of getting human beings to go into a crowded place and take all the right precautions, except for they're all very crowded in a small space and they're keeping a distancing and they're washing their hands and everything else, but lots of them in a very small space. You can't do that experiment, it's unethical. So they concluded that urgent high quality research is needed. And now there's a lot more to it. They have very strong evidence that it's not airborne, except in those crowded situations. So their strongest evidence, I think, is that the WHO for these 6 months have advised health workers they do not need respirators unless they are involved in aerosol generating procedures like intensive care. So for 6 months, health workers who have followed the WHO recommendation, which is most of them, have not been using respirators. And they have been in wards full of COVID-19 patients, and they have not been getting COVID-19. And the surgical mask and maybe a visor to stop droplets splashing into your eyes, they will not stop airborne transmission, they just go around it. So that is pretty good evidence. You know, if you keep, and they wear the mask, the surgical mask and the visors, because they're so close to people, well within 1 meter. If you could keep a distance of more than 1 meter, the droplets won't get to you. And you would be safe 1 meter away, walking around in a COVID-19 ward. So that's very strong evidence in my mind. That it's not, if it is needed in a crowded place, it's very surprising. Indeed, it's rather surprising if it's needed in a crowded place, because with the healthcare facilities, they have got people trying to detect COVID-19 in air samples. The way that works is you have a filter, which filters out all except the very, very, very small things, and gets even very small droplets get captured in the air filter. They then analyze the air filter, what they'd captured, to see if there's any COVID-19, and then sometimes they find none. So with other similates, some of right. So within samples, quantity detectors in extremely low numbers, and one study, and then only one study they found of the studies they looked at actually tested to see if the RNA they found was viable. Because the thing is that you'll get damaged to RNA. It's got little bits got knocked off it in the process of being transmitted. And it may be dead, or it may be badly damaged, and it just can't infect anymore. And maybe it was damaged even before it left the body. So what matters, and because sometimes when the body is completely destroyed, it's has completely overcome the RNA, overcome the virus. There's no living virus anymore, but you continue to shed the dead stuff until it's gone. So some of it could be dead RNA, and so one study, so there only one study tried to find it, tried to cultivate the virus, and it wasn't able to do it. So there really isn't any evidence that it is airborne even in a health facility. Just that some RNA gets spread in these small droplets. And that doesn't mean it's a virus. It's going to infect anyone. And as well as that, then COVID-19 is, if it's like SARS, and then it does seem to be from their experiments, it needs a high viral load. One virus can't get into your cells. The reason is because as soon as the virus comes into your body will mount a counterattack, even though it doesn't know what it is quite. So it won't be a very effective attack. But still, you need lots of virus to get through that. And typically it's very rare. Certainly for these diseases, I'm not sure how common it is to have a virus that can infect with just one virus, but it doesn't seem to be the case for COVID-19. You need a whole lot of, it's like loads and loads of attack. It's like a battle. It's been the analogy of a battle of, if you've got like 1,000 soldiers, then you've got 5 soldiers try and fight through them, they're not going to be able to get through. Even if you've got 100 and they're faced by 1,000, they're not going to be able to get through. And the body has an inexhaustible supply of its soldiers fighting back because it can constantly produce new ones. But with the virus, it's just whatever might got into you straight away, and that's it. So you need a high viral load to infect someone. And there isn't any evidence of any viable virus in the one example where they did actually try to cultivate viable virus in a healthcare facility where they were treating COVID-19 patients. So they think that theoretically it's possible that in these crowded environments with COVID-19 people and with very poor ventilation as well, then it may be that enough of the virus builds up in the fine droplets in the air so that you can be infected. But it may just as easily be, there's no doubt it does spread in those situations, but it may as easily be that it's just because there's an awful lot of people very close shouting at each other, because that would do it. And because of it sharing, it seemed, then I was very interested to discover as well, so they have very high level confidence it is not airborne in other situations. And I was surprised to find there's no proof that it's spread via surfaces yet. They think there probably is, but it's very hard to prove because every situation where it's been spread potentially via surfaces, it's also been a situation where it could have been spread via droplets. Again, you can't have the controlled experiment. You don't get someone who goes around and is always careful about the distance, but is very careless about surfaces. I mean, so they obviously haven't found anyone who is like that. So they just don't have any evidence yet that it is spread via surfaces. It's certainly not spread via parcels or in a very obvious way independent of the droplets. If it is spread by surfaces, it's only in situations where you also can easily be transferred by a droplet. So all this bit about hand sanitizers and stuff, that's being very careful, and you should continue to do that because it is possible it is spread via surfaces. It's just not proven. But it's very clear evidence it's not spread, it's not airborne in just about all the situations that you encounter. You'll never, except for very, very crowded situations, where you should, if possible, if it's crowded and there's not enough ventilation, like the bus, and Mike Ryan says, I'm not going to get on that bus, then think, do I really need to go to this situation where it's crowded and where it's got very poor ventilation? And if the answer is no, if it's not essential to your life to go to this place, even if it's a nightclub and you know you'd enjoy it, but or whatever it is, that this, or a pub or something, but is it essential if it's crowded and there's poor ventilation? And so you make your life decisions and you decide, is this so important to me that I want to run a risk of getting COVID-19? And then if it is that important, then be sure to wear a mask, a fabric mask. It may give you some, but it's really more to protect other people in that situation. So if everyone in that crowded situation where it's poorly ventilated is wearing the masks, then they're not going to infect other people. A fabric mask doesn't give you really protection in the other direction. Nothing short of and the ventilator things, then, I mean, they don't either if you don't use them properly. Most people don't use them properly. Indeed, you often see people, if you use the fabric mask, be sure to use it properly. Never touch the front. If you adjust it, don't adjust it from the chin. Adjust it around your ears, from the back. Never adjust a fabric mask on the front, because that annuls quite a lot of the point in it. Because, especially if it's damp, because if it gets damp from your coughing and sneezing, then you touch the front of it to adjust it, then touch a surface or shake hands with someone, then you can spread COVID-19 to someone else if you happen to have it very early and you're pre-symptomatic. But of course, if you do all the other things that they've been saying, then you could be like Mike Ryan and you won't get it. Like Mike Ryan, like Maria Van Kerkhove, like Dr. Tedros, and you just won't get it, even if you're in a place where there's lots of COVID-19. Just like if you're really expert like Mike Ryan, you can go around interviewing people with Ebola, and you won't get Ebola, because you know how not to get it. So, then, yeah, I'm going to stop soon, but, yes, so this shows the importance of not just relying on people. So it's good to find the good science. So people who do science well, like the WHO, then it's good to listen to them. But the problem is that most people, when they say, oh, I listen to the WHO, or I listen to the IPCC, and you go and talk to them, then it actually turns out that they really mean, I listen to the journalists who report the IPCC, or I listen to the journalists who report the WHO. Sadly, if that's what you're doing, it's very likely that you have at least some very bad misinformation that you believe. A very bad in the sense of incorrect. And this is an example. And many people have misreported the WHO as saying that the aerosol transmission is confirmed. And this has a significant effect. Because a lot of people are now saying, we've got to do masks, wear fabric masks. And they think that wearing a fabric mask is what you've got to do rather than the physical distancing. But the physical distancing is absolutely prior. Do the physical distancing, you don't need the masks. You need the mask for situations where you can't do the physical distancing, or if your local laws, your governor says to use a mask, then do it, because to show a good example and follow what they say. So even if they say use a fabric mask, even if you're 2 meters away, and the WHO say 1 meter, then don't quibble about that and say, oh well, I'm going to follow the WHO, because you need to encourage everyone around you to follow whatever the guidelines are that they are using in order to try and defeat this virus. So I'm not saying do different from what your government says, and WHO say follow your local guidance. But pay particular attention to the physical distancing, and that is the thing. And then washing your hands very thoroughly, all of them, front, back, fingernails, follow the entire procedure that Dr. Tedros outlined. And then don't touch your eyes, nose or mouth except with washed hands. It takes quite a while to get used to it. And so I think even for the first week or two, I was still touching my eyes, nose and mouth quite often. But now I've got out of the habit. And so you can do that. And at the moment it's quite difficult, you can't get quite fidgety. But eventually you can get out of that habit, and that is a very good thing to do. That will also reduce your risk for flu. Now, this is not going to, if you still get sick with flu or cold, then don't feel that you're doing anything wrong, because this advice will not protect you from flu or colds. You get a flu or a cold, they are definitely airborne. So just by in the same lift as someone, you can get flu from them or a cold. So you might still get flu or colds. You'll have it definitely reduced, but this will completely stop COVID-19. And if everyone did this, what I just described and what the WHO described, it would be gone within 2 weeks. Then if everyone throughout the world for 2 weeks did proper physical distancing with the hand washing and everything, and never got involved in crowded places, and if all the healthcare workers had adequate personal protection equipment, because obviously they have to be closer, and so if we had adequate PPE for everyone who needs it, and if everyone else in the world did physical distancing, then within a fortnight, then there would be nobody left who can transmit it to anyone, and then the testing as well. So anyone who had symptoms would be tested and then isolated, and all their contacts isolated. And within 2 weeks, then everyone except the asymptomatics would already be isolated. And the asymptomatics don't seem to be spreading this. Singapore were able to stop it without, during the early days before they got lots of imported cases, without very, very detailed looking at every testing, widespread testing of the symptomatics throughout the whole of Singapore, and they just didn't get the cases that you would have got if there were asymptomatics spreading. So, we could stop COVID-19 with proper physical distancing alone. We could stop it with test, trace and isolate alone. We could stop it with a very rapid, fast testing of lots of people without the tracing. And then we can also stop it with the vaccine. So we have 4 different ways of stopping it. We also have a 5th way, which is the lockdown. Oh, it's that 4, what is it? Test, trace, isolate, physical distancing, what was the other one? Testing lots of people, and that's how they stopped it in Slumdog, in the slum of Slumdog Millionaire. They did lots and lots of testing of people, and then they isolated them because they couldn't do the tracing. They isolated them in separate wards because they couldn't isolate them in their slums, and the tracing was very difficult as well. So they just did loads of testing, and they did what they could of everything else, and they isolated them in special sports building set aside for isolating people, and then they got it completely rid of it, and they from it being definitely increasing very rapidly to it gone. So that's the 3rd way, and then the 4th way is the lockdown, which is where since people are not doing the proper physical distancing, and the government is not doing test, trace, isolate, the government doesn't know where it is at all, so they can't just lock down particular places, so they lock down the entire country. That is the reason they do a lockdown. The lockdown is to force people to do the physical distancing, because they're not doing it themselves in their ordinary life. That's the only reason to do a lockdown. If we all did the physical distancing, and it's only 1 metre, you don't need the 2 metres, all this thing about having every second person, and then if you're sitting next to someone in a bus actually, unless you turn around and talk to them, then then you're not going to be infected by them, then you're not going to infect them if you've got it. And we've had numerous cases of people who came back from Wuhan in plane flights, and they didn't infect anyone in the same plane flight. And it's very different from SARS. So it's very basic stuff. Do the physical distancing and do the hand washing, which may be necessary, might even be necessary because they don't know that it's spread via fomites. But it's the safe thing to do. Do the thorough washing of your hands, not touch your eyes, nose and mouth. And keep the physical distance, which is the most important thing of all. And you're protected. And if we all did that. So anyway, so we've got, but because people don't do that, then you have the physical lockdown, the countrywide lockdown as the 4th way of doing it. And then if we get a vaccine, so, and I got lost again. So you've got the lockdown, you've got the test, trace, isolate, you've got physical distancing, and then you've got to test lots of people at once. That's the 4th one. So like I did in Slumdog Millionaire's slum. And then 5th one, you've got the vaccine. And all those methods are sufficient to change it from increasing to decreasing. But the lockdown you can't keep going for indefinitely. You could bring it all the way down just to a lockdown. but it just brings it down so slowly. So you need to add something else on top of that, and then ease from lockdown, because it's such a huge economic hit. But if you have enough testing, then you can do targeted lockdowns of small areas within a big outbreak in other areas where it's not spreading. And so targeted lockdowns, I suppose that's a sixth way of doing it, targeted lockdowns, but it's a sixth technique. Anyway, so we've got loads of different ways, each of which independently would be able to suppress this. And then combining them all together and then add a vaccine on top of that. So when we get a vaccine, it's not going to be just we immediately go back to normal. The sensible thing to do when we get a vaccine, and we're just about certain to get one, and probably quite soon, then is to keep up with the suppression and then do the vaccine on top of that. And then we can stop it very quickly. And then we have to do it all the way around the world, and it'll probably take a year or two to get to everyone in the entire world, because you've got to make sure that everyone has been vaccinated, even the most remote and the nomads and the people in the jungles. I don't know what they do about the uncontacted tribes. I suppose if they're totally uncontacted, they don't need it. And then eventually we'll be over it, and it'll be done. So, anyway, so hopefully that helps you now realise it's very, very strong evidence, I think. And evaluate the evidence for yourself. I've just explained it to you. But I got sidetracked. So, so who do you listen to? Then sadly, so I've got these bits at the end of this article. I'll put this article in the description. You can read it. So sadly, you can't. Have I got it there? Some of the worst doomsday fear fact-checking errors. I might do a video about that. And there's just been so much absolutely false, mistaken, seriously wrong things, shockingly wrong mistakes in the media since 2018, especially about climate change. Absolutely shocking. And so, sadly, you can't believe what if you listen to a journalist, then they're not going to tell you the right things a lot of the time. It's very difficult to know who to recommend. Carbon-free for good, because but they're rather technical. And the IPCC sadly don't do, but I don't do what the WHO do. I wish they would. I would strongly recommend. I think it'd be a very good idea if the WHO and the IPCC were to let themselves be interviewed by the social media. I hopefully what the WHO are doing here, if you watch this video, then the WHO were getting questions asked by the public, and so on TikTok mainly it seems, but they were basing it on questions that people were asking, so it didn't really matter that you were not able easily to rewatch it after the event. But these are the questions that most people have. They're the very same questions that I get people asking me all the time. And so this is what we should have. I think lots of scientists should do this. I think that the IPCC should do this, and IPBES should do this. And anything that is in the front line of media, the asteroid people should do this. So the people who do the asteroid alerts, and the NASA, the Center for Near-Earth Object Studies, they should do this too. Find some time, and these are incredibly busy people. They're working 7-day weeks since the start of the outbreak, and they get up very early in the morning, and then they have many things to deal with, not just COVID-19, many disease outbreaks they have to deal with. These are exceptionally busy people who found 44 minutes every week to talk to the general public. And they found hours. Early on they were doing these press briefings well over an hour, 5 days a week, and now down to 3 days. Is it 3 days still? Or I think they're down to 2 now. Yes, 2, Monday and Thursday. And these are people who are exceptionally busy, and they're saving lives. They're not just doing fun things that they're doing. They are needed urgently by people whose lives are at stake, and yet they are spending hours every week talking to the press, talking to the general public, because that's how very important they think it is to be able to communicate directly to the public. And you can take advantage of this, and you can listen to them. I recommend listening to live Q&As especially. These are them talking directly to you, answering the questions that you have. Very difficult. The ones that the journalists ask are often rather politically slanted. What do you think about Trump? What do you say about Bolsonaro? And they just have to say, we as the WHO do not comment on individual countries. They have this disclaimer things they say, because they cannot say bad things about anyone, because they just wouldn't be able to function if they went about accusing people of the things they're doing wrong. So the press conference is always full of at least half the questions are from journalists making rather pointed questions, especially at the height of some kind of thing that's going on. Like what are you going to do now that the US has withdrawn from the WHO? Oh, by the way, on the US withdrawing from the WHO, I'll stop soon. But on the US withdrawing from the WHO, you might be interested to know that their COVID response fund, which you can personally go and donate to, this was a very innovative thing they did this year. And I think it's 200 million or something they got. It's roughly the same as the US annual contribution is the amount the general public is giving to the WHO to help with COVID-19. And in the case of the US, although they are no longer donating this to the WHO, their contribution for this, I think, is already set in stone, so they can't change it. So they will be contributing for this year. But they also have lots of funds that they give to other countries separately. But the WHO is especially effective because they have so many contacts in all the countries. And that's basically because the WHO do not get involved in telling countries, in publicly shaming countries. Anyway, so hopefully this has helped with a few things, and so my next video is going to be on how the situation is much more hopeful than it's really looking pretty hopeful in the United States that we're getting over this second wave there, and so I'm going to do that to help some of the people who post to our group who are so very scared, and by all the huge hyping up by the as you get older you get a slight delay. It just increases slightly. You delay in remembering things. There's some things that don't change at all, and then some things that your reaction time is just a tiny little bit slower. And the few things that get slower as you get older, and other things don't change at all. So it's kind of quite interesting. Don't know why that is. Don't know why your reaction time slows down as you get older. It's not by a huge amount. Anyway, but other things don't change at all. For instance, in mathematics, if any of you are watching, you're old, you're sort of thinking, oh, I'm old, I'm going to lose, unless you get Alzheimer's, obviously in that case you do lose your intellectual functioning. But if you don't get something like Alzheimer's, then you can keep your intellectual functioning continues just the same all the way through until you're 100 or whatever. Very famous example is Paul Erdos, who is a mathematician, and you have this kind of thing that, mathematicians do all their best work when they're young, and then you ask, well, what example do you have? Say, Ramanujan, and what's his name? Just Galois. And then you go back, but Galois was killed in a duel, and when he was a young man, and Ramanujan, then he died in the UK because of his health wasn't able to cope with the rather with the UK winters. And so the reason they did all their best work when they're young is because they died young. And the ones who lived to an old age, like Euler and like Paul Erdos, then they did lots of good work all the way through, and he was doing groundbreaking work all the way until he died. So no, it's not true that anything happens to general intellectual impairment, but certain things do happen to certain things. Reaction times do slow down a bit, and certain other things do change. And it could affect, if you're severely affected, then some of these changes can mean that you can't drive eventually when you're in your 80s, that sort of thing. But it depends, a lot of personal variation. Anyway, I'm just going to stop this now. I don't know how I got involved in that. I'm going to start talking about the, oh yes, for anyone who's, I've lost track of how I got there. There was a reason for it, but I think I answered it. Anyway, so if any of you are scared, then to join our Dream City Bump group. And if any of you are good at helping people who are scared or are knowledgeable and have some area of knowledge, but please don't just talk about things if you don't know and just guess. We want our debunkers to do the debunking based on things that they know. If they don't know, to do reliable sourcing. If they don't know how to do reliable sourcing, then you can learn how to do that. And if it's not your thing, then just reassure people and try and find someone else and tag someone or who you know is good at answering these sort of questions and has the background information to be able to do it. That's basically how we function. Anyway, so that's very important as well. I'll stop this and upload it, and then another shorter video to help people who are scared of what's happening with the second wave, as it's so called in the United States, which isn't really a second wave.